Alright, I'd really like to finish talking about the kidney stone experience today. So I'm going to try to wrap this up here. So I'm going through the paperwork that I got from the hospital from having the kidney stone. Alright, so this is my doctor's note that I got that I had to be persistent to get. Urgent care note. I was 40 years old when I got this kidney stone. I feel old when I say that. Okay, so this is the doctor's note. It's urgent care note. Emergency department work/school excuse. This patient was seen in the emergency room today, it says. That makes it sound really serious. It was just the urgent care area. Please excuse from work/school for 2 days. That's pretty much it. It's just the doctor signing his name. Oh, here's the bill. Kidney stone bill. It's a lot. It says, I have this circle here. It says IV therapy. I don't remember getting an IV. I was thinking, well, is that a mistake, or was that when I got the shot in the butt cheek for the pain? I didn't get an IV. That says $71. Laboratory. I don't know. Maybe that was the urinalysis. $287. CT scan when I got the X-ray. Whoa, this was the most. Just to look at my insides. $2,464. Clinic. I don't know what do they mean by just clinic. That was $257. But then, okay, so then it says drugs /detail code, $24. I'm not sure about that, because these pills here, the prescription, that was probably a separate payment. I don't know about the $24 there. Then it says Profi/Rad/DX. Not sure about that, but it costs $260. Then it says commercial insurance payment. Commercial insurance payment, and so that was a payment adjustment of $1,611.37. And then it says insurance adjustment credit, $331.74. So the total charges came to $3,363. But the total after the adjustments, there was the adjustments totaled $1,943.11. So my balance was $1,419.89. But even after that, I had my insurance was weird. I thought. I think this is the first time I ever had insurance from work for this, but it was just like a card. Like, I think it was called Payflex card. So I call the number on the card to find out how much my balance is for this insurance, and then I So I go by that balance, and then I give that my card number to the hospital, and that's how I paid the bill. So after the insurance card, it wasn't too bad, but that was a lot to pay for. That would be a lot to pay for if I didn't have the insurance card. So here's the pharmacy. Oh, so this is for Flomax. This is for one of the pills I had to take. For uses, it says tamsulosin is used by men to treat the symptoms of an enlarged prostate, benign prostatic hyperplasia. It does not shrink the prostate, but it works by relaxing the muscles in the prostate and the bladder. This helps to relieve symptoms of BPH, such as difficulty in beginning the flow of urine, weak stream, and the need to urinate often or urgently, including during the middle of the night. Tamsulosin belongs to a class of drugs known as alpha blockers. Do not use this medicine to treat high blood pressure. So there's a bunch of side effects and precautions. Drug interactions. So I don't think this wasn't. This was the one Flomax. This was the one. I think the doctor said to help reduce the size of the kidney stone, to help keep it flowing. I think through the ureter. So I don't think this one was for pain. So that was the one, I think, once a day. Yeah. Yeah. One a day. That was just to keep the kidney stone moving, I guess. So, okay, now this one. Huh. Uh, diclofenac. Yeah, that's the one that I had. I took 2 times a day for the pain. Common brand name Voltaren. It says diclofenac sodium enteric coated tablet. Warning: non-steroidal anti-inflammatory drugs, including diclofenac, may rarely increase the risk for a heart attack or stroke. This effect can happen at any time while taking this drug, but is more likely if you take it for a long time. The risk may be greater if you have heart disease or increased risk for heart disease. For example, due to smoking, family history of heart disease, or conditions such as high blood pressure or diabetes. Do not take this drug right before or after heart bypass surgery. Also, this drug may rarely cause serious, rarely fatal bleeding from the stomach or intestines. This effect can occur without warning symptoms at any time while taking this drug. Older adults may be at a higher risk for this effect. See also precautions and drug interactions section. Stop taking diclofenac and get medical help right away if you notice any of the following rare but serious side effects: bloody or black tarry stools, persistent stomach, abdominal pain, vomit that looks like coffee grounds, chest, jaw, left arm pain, shortness of breath, unusual sweating, weakness on one side of the body, sudden vision changes, slurred speech. Talk with your doctor or pharmacist about the risks and benefits of treatment with this medication. Uses: diclofenac is used to relieve pain, swelling, inflammation, and joint stiffness caused by arthritis. Reducing these symptoms helps you do more of your normal daily activities. This medication is known as a non-steroidal anti-inflammatory drug, NSAID. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and or use other medications to treat your pain. See also warning section. So, reading these drug warnings about side effects, these possible things that might happen, these rare things that might happen, it's kind of scary to read these. Thinking, well, it's possible that this might happen, but you need to take something for the pain. When you're in pain, it's very helpful to take something for the pain, but just looking at the things, side effects are kind of scary. No, this is just more about NSAIDs. Side effects. More stuff that is scary if you dwell on it. There's this thing for tramadol. I don't have a bottle for this tramadol. I don't remember what it was. If this was another pain pill. It's from the same time. I guess I may have taken this tramadol. Huh. Okay, all right. So I've had these on my fridge. These on my fridge. I got the information on these from these books. So it's How Not to Die, and the other book is called How Not to Diet. They are books by Dr. Michael Greger. And so there was some dietary information in there that I put on amounts of types of foods that are recommended to prevent health issues. So that's what I've had on my fridge for a while. And there's some of these are applicable to the kidney stone discussion. Okay. So according to from these books, it's there are some foods that contain high oxalates that has been associated with kidney problems when consuming more than a cup a day. So something to be aware of. Something to be aware of with the high oxalates. Because they've been associated with kidney problems if you consume more than a cup a day. So that are those types of foods are almonds and cashews. Well, that's what that doctor was saying about the nuts. If you have too many nuts. So that's interesting, something to be aware of. There's something else on here, I think. Yeah, spinach contains high oxalates, but it's okay. On here it says boiling reduces oxalates by 60%. A Harvard study found that people who ate spinach 8 or more times a month had about 30% higher risk of developing kidney stones. So I definitely wanted to be aware of that. That's something to consider. Oh, also chaga mushroom powder has been associated with kidney problems when consuming 4 to 5 teaspoons a day, and rhubarb when consuming 4 cups a day. So those are more about high oxalates. All right. And then also drink at least 13 cups of water a day, which works out to a cup every waking hour. Kidneys can only handle 3 cups an hour. Too much water consumption at one time can drain electrolytes from the brain. So that's interesting. All right, so the last thing. Oh, this video is long. Okay, so the last thing I want to mention that I was thinking about the Kramer with the scene from Seinfeld where Kramer had the kidney stone. Now I just wanted to I rewatched that, and I also saw a couple other videos on YouTube about kidney stones. Related to kidney stones. One of them was a urologist video where they were reacting to the episode of Seinfeld with Kramer when he had the kidney stone. So that was interesting. So I'm going to be attaching some links, and these links will be in the description section of this video. Okay, long video, long set of quite a few videos here about kidney stone, my kidney stone experience. Okay, that's enough. That's all I need to say. It hurt. Try to avoid it if possible.